Welcome back to the bonus video with Dr. Ryan Hooper, aka Dr. H. And we're gonna go through your top 3 keys to eye health or eye success or success with your eyes, whatever you want to call it. Just I'm super excited because I have not seen you for a while. You were, now in my defense, you were in Texas.
Correct.
So that was a long drive for my eyes, but I'm looking forward to checking out your new location in Rocky River.
Yes.
Sign me up, and I'm looking forward to learning more. So go ahead.
So I think the one thing that I'd really like to share right off the bat is talking about preventative eye health. My new location, as you referred to in Rocky River, is West Side Preventative Eye Care. I really want to explain to people why eye health is important to them. I think that, we talk about dentistry and the medical profession. They've done a great job of really explaining why going and seeing them is important for your health. And I think we have, as optometrists, have really dropped the ball on explaining like why does this help you? How does this benefit you to come see us? So a stat is like the average person. The AOA recommends you see an optometrist every year to take a look at the back of the eye and make sure everything looks healthy. The average person comes in about every 3.5 years.
Okay.
So
sounds about,
yeah.
Sounds about right.
So just to kind of show people, I think that we hear about diabetes and things that can affect the eyes. A lot of people don't even know that, but you can go blind from diabetes. So 2 cases that I've seen. One gentleman came in completely asymptomatic, was questioning whether he wanted to do a dilated eye exam.
By asymptomatic, symptomatic, that means like no symptoms?
No problems. Yeah, no problems. Yeah, sorry.
I don't have that doctor brain, so you got to talk to me like I'm a little kid. So
he came in, no problems, no complaints, just came in for a routine eye exam, was questioning, should we do the dilation? I'm like, well, it's recommended every year. So we went ahead and did the dilation. I looked back and I saw a tumor in his eye, actually. So typically when a tumor comes into the retina, we're talking about leaving the liver or metastasizing from the liver or the lung. So, we sent him on his way and he got care. But that's something that I bet most people don't think about. I'm sure he didn't come in thinking that was what he was going to find
definitely. I have a tumor and, wow.
Yeah, so and then you mentioned my time in Texas. There was a patient I saw, she came in, didn't tell me this, but was at the hospital previously that day and came in with blurred vision. I looked in the back of the eye and, I saw swelling and hemorrhaging and bleeding and things in the back of the eye, and unfortunately I had to send her in for blood work. There's different viruses and things that you can acquire that causes bleeding in the back of the eye, but that helped that patient diagnose, again, talking about a holistic approach, she had a virus in her body that I was able to look into the back of the eye and see the problem. So, a lot of people talk about the eye as the window to the soul, and it's a bit cheesy, but
but it's true.
It certainly is a window into the back, into the body. It's the only place in the body we can see the blood vessels in the back of the eye, and actually look at one of your cranial nerves, cranial nerve 2, the optic nerve that runs to the eye. So we literally get to look at part of your brain and part of your vascular structure and make sure that everything looks great.
And then, so you can, obviously depending on the situation, but you can say, hey, based on the vascular structure of your what's going on in your eyes, you may have some issues in your liver, or you may have some issues in other places.
Yeah, a lot of times kidneys. High blood pressure is one thing that we can diagnose. The female patient that I saw in Texas had high blood pressure too, which also could have caused some of that bleeding in the back of the eye. So when we talk about preventative eye health and when we think about preventative eye health, these are all things that we wouldn't necessarily catch if we didn't do a dilated exam and look in the back of the eye. If that tumor that I was talking about traveled from somewhere else, how do you really find that without
before
symptoms?
It's too late? So I'm not gonna jump in. So I don't want to derail what's going on.
Sure,
I have so many questions. All All right, so preventative eye health, you recommend, is it once a year, every 6 months, or what's defined preventative eye health in a, if I or someone watching this is like, okay, I need to commit to that, what does it look like?
Yeah, so a dilated eye exam every year is what's recommended by the American Optometric Association. So coming in once a year, doing the dilated exam, I mean, it stinks. Nobody wants to do it really because, you know, it does blur your vision up close. It'll last for about 3 to 4 hours. So if you bring somebody to the appointment that can drive you, it's really not that bad once
Well, it could be good bonding time with the old buddy.
Sure, that's
like,
right.
Hey, you want to come to my exam? Yeah, let's get dilated.
Yeah.
All right,
As
cool.
long as you have a driver, I mean, it doesn't really affect people too much in other ways.
Gotcha. Okay, so just make it part of your routine. Make it part of your
just like your physical, you know, and really not overwearing those contacts and things like that, coming back in a year and getting those done.
Speaking of contacts, I believe that you will help me get contacts in my. I went to an eye doctor. I spent about an hour trying to get the contact in my, because legally you can't send someone off with contacts until they've actually got them in their eyes, correct?
And can take them out without hurting themselves, yes.
Okay, so I am yet to have contacts because I've never been able to get them in my eyes before eventually my nose starts bleeding and I get all, it was bad.
Not everybody has this experience.
Not everybody is as uncoordinated as I was like, So I poked my eye so many times that my nose started bleeding. That was a very, they had like every single person that worked there. Like at every position in the building was coming. They're like, just like, try this, try that, try that. So don't give up hope. Don't give up hope. So, but if we can't get the contacts, I'm sure you can provide me with glasses and we'll be good to go. So preventative. Yeah. All kinds of fun stuff.
So, and that preventative portion will extend to, you're talking about contacts and things. When we talk about preventative eye health, obviously when I was talking about kind of the holistic or systemic stuff that we can find in the back that not many people know about, we can actually talk about your prescription as well. When I talk about a preventative approach to eye care, I'm also thinking about your actual vision. So since 1960s and 70s, nearsighted rates have actually doubled in the United States. And I think when you think about
which is what I have.
Yes.
Okay.
Yes.
So nearsighted means I have trouble seeing far away.
Yes.
Farsighted means I have
trouble seeing up
close. Okay, so it's the opposite.
It's a little bit the opposite. We're tricksters like that.
All right, I remember that.
Yeah, there you go, man. So I taught you well.
Thank you.
So in China, it's actually around 90% of the population is nearsighted. And they have actually been really leading the way on how to actually reduce nearsightedness in the population. When we talk about nearsightedness, we're mainly talking about the eyeball stretching. So that puts you at a higher risk of retinal detachments, which eventually causes blindness, glaucoma, macular degeneration, everything that you don't really want to hear us talk about. Myopia puts you at a little higher risk for it.
Okay.
So they've really been on the forefront of how do we reduce nearsightedness or at least nearsighted progression. It's kind of easy to understand why our prescriptions are going up for nearsighted prescriptions because we do so much right in front of our faces now.
Right.
How many 3-5-year-olds do we see that are using a tablet or a cell phone, right? So our eyes are just trying to adapt to that and move the vision in because it's just a natural adaptation. We used to get something called college myopia where you would go to school, you would start studying, and the nearsighted vision would creep in then around 21, 22. Now we're seeing that 8, 9, 10 years old. And the earlier that myopia starts or nearsightedness starts, the more aggressive it is. So it is becoming a problem. So as far as preventative health and preventative eye care and how we look to treat that is a corneal mold called orthokeratology. It's almost like if you think about, again, dentists have done great jobs of explaining what happens. It's basically like a corneal mold is like a retainer for the eye. So for lower prescriptions, you can actually wear these corneal molds overnight. They correct your vision throughout the daytime, and you actually don't need to wear anything through the day. Now, the benefit associated with that is it actually stops the eye from growing by about 46 to 50%. So young children who come in with a small prescription, we can place these corneal molds on their eyes, check, make sure that they fit well. They go home, they sleep in the corneal mold, and the next day they come in, they take it off, they're 20/20, and we don't really see progression of their prescription. It kind of stops it in their tracks. So what I hope to do at Westside Preventative Eye Care in Rocky River is when we see emerging nearsighted patients, provide them with these corneal molds and try to stop progression of myopia and
stop it in its tracks. That's awesome.
Yeah.
So that's where JJ, he's almost 2 years old. So is there a certain age that obviously like he's not having any issues like seeing things, but is there a certain age that you bring your children in to see you? Like, how does that work?
Yeah, so I think it's important to get an eye exam before the age of 3. A lot of times we're really just looking for gross abnormalities. Do you have an eye turn? On my test, do I see a huge reflection of a huge prescription? The eye is somewhat underdeveloped, so we expect to find like a far-sighted prescription up until about age 8. So I would say 1 to 3, and then really every 2 years from there until we start getting into what's the prescription now.
Okay,
is typically what I recommend.
Cool, but I could book an appointment, me and him together.
Absolutely, yeah.
And he could drive me home when my eyes.
Yeah, there you go. Once we dilate you, yep, he's ready.
Cool. All right. We'll have to figure that part out. Well, Uber.
Yeah, right.
Uber. There we go. So.
But no, he, for him, we would just, really look for any gross abnormalities. He's not going to be able to tell me 1 or 2, which is better.
Yeah.
But we'll be looking for, a general prescription. If you see people with eye turns and things like that, a lot of times, not always, but sometimes those cases could have been caught earlier and corrected before they get to that point.
That's wild.
So again, preventative eye care, maybe not something that people think about.
And is that something that, like the retainers for your eyes, quote unquote, is that something that that could help me from having my vision continue, or is it too late for me?
Yeah, so that's a good question. So typically the biggest change in prescription comes between 8 and 12 years old. And like I said, the less
it's a little too late.
So the later that progression happens, the later that happens, the less aggressive it is. So the patient that I really need to get into the corneal mold is that 6, 7, 8-year-old that's starting to show signs of myopia.
Yeah.
So I wear corneal molds at night. I'm not wearing anything right now. With your prescription, I believe if you're a low myope, you could wear them and you wouldn't see progression. But typically after the age of 21, 22, the eye has stopped growing and you don't see a whole lot of progression anyway.
Okay.
But, it's the benefit of not wearing contacts or anything during the day, avoiding dryness during the day.
Yeah.
It's still a possibility for
somebody. Especially for those of us that can't even get the contact in their eyes.
Yeah, right.
So that's one day. So, all right, so we got the preventative eye health.
Yeah.
The myopia control, correct? And then...
Yeah, so really just maybe kind of understanding the guidelines of what we were kind of talking about, reasons that it's important to change your contact lenses. So you do want to come in every year, 2 at the most, and have that dilated eye exam done. Like I said, the American Optometric Association recommends you come in every year. Preventative eye health is something we really need to think about. Changing your contact lenses. Another thing that maybe people don't necessarily think about is overwearing their contacts. I just wear them until I get dry
I have some buddies that are like, I just wear them until I can barely see anymore.
Yeah. And so the reason that's happening is because all these things are getting stuck to your contact lenses, and that's blurring your vision. So if you think about different things that can get stuck to your contact lenses, bacteria, viruses, fungi even in cases, and if you accidentally fall asleep with that contact, well, you're creating a moist, warm environment for that fungus, that virus, or that bacteria to grow. And we've seen cases of blindness occur from someone who sleeps in their contact lens. So really just, like I said, I think maybe we've, as a profession, have dropped the ball on educating patients on what these things are. So not sleeping in your contacts, coming in every year and getting an exam done and just kind of following those guidelines, I think is really the key to success as far as your eye health and preventative eye health goes.
So stop making excuses and just do it. Just
basically.
Just make
Trademark.
it happen. Trademark.
Just do it.
Just do it. Awesome. So very cool. Well, so preventative care, making sure that you are controlling your myopia.
Yes.
Correct. I always want to say myopia. Or myopia. Is that it?
They both work.
Tomato.
Yeah, exactly.
All right. Cool.
Totally,
But and then just do it. So that's where my commitment to everybody is. Sign me up. We're gonna get me going, and JJ will be there.
Sounds good.
Bring Erica, the whole family, whole
gang.
Yeah,
great.
it'll be a party, man. Be a party.
Hey,
So
happiness, man.
It's all about happiness, man. Happiness in your eyes. So, anything else to add, my man?
I think that's it. Come see us over in Rocky River, Westside Preventative Eye Care. We're in Beach Cliff Market Square.
Beach Cliff Market Square.
Yes.
Ooh, sounds fancy. Oh.
That's a nice spot.
Nice spot.
Some good restaurants in around.
Pretty decent.
Yeah, while you're dilating, you can feel free to work out next door. Some good stuff over there.
Oh, what am I lifting? Oh, that's awesome. That's awesome. Awesome. Very cool. Well, thank you so much, man. Appreciate it. Thank you, everyone, for joining us for this bonus video. I've learned a lot.
Good.
So thank you again for everything you do and your expertise. Hope you joined a lot. And until next time,
stay burn proof.
Keep your eyes burn proof.